Bismillahirrahmanirrahim. In today's presentation, we will be talking about Hodgkin's lymphoma. Well, Hodgkin's lymphoma is the new plastic transformation of lymphocytes, particularly in the lymph node. So, what will be the clinical features? The lymph node will be enlarged, but the enlargement will be painless, rubbery, non-erythematous and non-tender. The patient can also develop B symptom, and the disease can also involve the extra lymphatic sites, the sites that are outside the lymph node. How we will stage the disease? So there are 4 stages of the disease. In stage 1, one lymphatic group or single extra lymphatic site is involved. Stage 2, 2 lymphatic group or extra lymphatic site on the extra lymphatic sites on the same side of the diaphragm. Remember, either 2 lymphatic groups or extra lymphatic sites on the same side of the diaphragm. In stage 3, involvement of the lymphatic group on both sides of the diaphragm. Or involvement of an extra lymphatic organ contiguous to the primary nodal site. In stage 4, it is a widespread disease that involves multiple sites, such as bone marrow or liver. Well, the prognosis is worst if the patient develops B symptoms, or if there is large mediastinal lymphadenopathy, or the age is more than 40, and as we already discussed, if there are B symptoms, or the electrocyte sedimentation rate is elevated, then the prognosis is at worst. What are the types of Hodgkin's lymphoma? So there are 4 types of Hodgkin's lymphoma: nodular sclerosis, lymphocyte rich, mixed cellularity, and lymphocyte depleted. Nodular sclerosis is the most common. Subtype that constitute about 70% of the all cases. In nodular sclerosis, the lymph node is divided by band of sclerosis, as the name shows, sclerosis. So the lymph nodes are divided by band of sclerosis, and Reed-Sternberg cells are present in lake-like spaces which are called lacunar cells. The important consideration about prognosis is that the lymphocyte rich has the best prognosis. The more the lymphocyte, the better will be the prognosis. So lymphocyte rich has best prognosis, while lymphocyte depleted has a small number or no lymphocytes, so the prognosis is worst and the disease is aggressive, while mixed cellularity has a medium type like of prognosis. For the diagnosis, we do lymph node biopsy to establish the diagnosis, and to establish the extent of the disease, we perform X-ray chest, CT, and CT abdomen, and MRI. Bone marrow biopsy is used to definitely determine if the disease is truly localized. It means that if we want to know whether the disease is localized or not, so we do bone marrow biopsy. Other tests include FBC, LFTs, and lactate dehydrogenase. For the treatment, we go for radiation and chemotherapy. Radiation is reserved for a disease that is not much advanced, for early stages of the disease, like for stage 1 and stage 2 disease. While chemotherapy with adjunctive radiotherapy is for stage 3 and 4 of the disease. In the chemotherapy, we give ABVD, adriamycin, bleomycin, vinblastine, and dacarbazine. So this was all about the Hodgkin's lymphoma. I hope that you guys will have enjoyed my lecture. If you have enjoyed this lecture, please give it a thumb up and subscribe to my channel. See you next time. Thank you.